Dentist, she's very good with cosmetic aspect of the dental work. Now what I see on your scan is you're having a lot of protrusion even here.
Okay.
This is all the teeth,
Yeah.
not the bone.
Okay.
And that is supporting your lip quite well now. So when I look at you, you're looking nice. And the vertical height of the maxilla is not too much.
Okay.
If it's excess, we call it a VME, vertical maxillary excess. That's an ideal candidate for a surgery.
Okay.
But you have had earlier what is called as a bimaxillary protrusion, or we call it as a bimax, where both the upper and lower jaw have come forward like that.
Yes.
But that was both skeletal and dental earlier.
Okay.
So these guys have done a Invisalign treatment for you that is called as compensatory orthodontics.
Okay.
Either because you have not told them that you're willing for surgery, or because they are not aware that a surgical option is there for the dental, for the skeletal issue.
Okay.
Whatever that is, this is irreversible. So there's no point dwelling on that now.
Okay.
But what has happened? They've removed 40. They've corrected your dental issue.
Okay.
Your dental is actually quite nice,
Okay.
but not the skeletal component that was there when you started off the bimaxillary. Now, unfortunately, because the compensatory orthodontics has been done and completed, and your facial balance is pretty much nice, and you shouldn't do a surgery to take it inside because that's going to increase the age. So I think surgery is not a very good option. It's not impossible, but understand it's not a great option.
Okay.
So the next option is, I just show to Sarah. See, she has a little incompetent lips. Smile nicely. Look at that. And so what I was thinking was, yeah, we can do a smile designing for her. Smile, smile, smile. And you can look at these teeth, how they're coming down. They're not going straight. The lip line is going straight. You want to see the mirror?
Yeah.
Come. I'll show you the mirror so you understand. Smile. So you can see the lip line is going straight, but the gums are coming down, right? So what we can do is we can take the gum line also along with the lip, and we can reduce the height of this teeth and contour it in such a way that your teeth also will come like this. So your new smile, your gums will go more up. It'll be a straight line like your lip. So it won't look. Now the reason why it's not looking nice is because the gums are coming in the center. Yeah, it looks like there's something happening there. So that we can correct without a surgery. And I think even though your lips are going to be a little bit incompetent the way it is, you should be fine.
Okay.
And that's not a surgery like a general
So my
anesthesia.
teeth will not be. It'll be bigger in size after.
A little bit, which will actually suit you.
Okay.
Bigger in the sense of proportion,
Okay.
but we're going to reduce the height of it.
Okay.
That she will decide.
Okay.
She's good at that. Sarah will tell you, and there'll be a small surgery in the gums, because on the scans, I don't want to do a jaw surgery for you. You have a very nice profile. Everything is nice. Also, if I do it here, this part, I don't want the lip to lose its support.
Okay.
So,
Not required.
yeah, I think not required.
Okay.
And that's a bigger procedure, bigger recovery,
Okay.
everything bigger.
Okay.
And if your cosmetic improvement is not worth it, and this cosmetically will be a huge improvement.
Okay.
She show you some of the patients that she's done before.
Okay.
Superb improvement.
Okay.
Okay.
So what can we do for the lip incompetence? Right now we can't do anything for that.
So the lip incompetence is minimal. If you want, there are two options. One is we can do a lip lengthening, but I don't recommend because the lip is long enough.
Yeah.
So the best option out of the three options, one is jaw surgery to correct that, one is lip lengthening to increase the length, third is to do nothing. I would recommend do nothing for you as a best option.
Okay.
But then if you want something, we can. But I think it's better considering your soft tissue drape, your aesthetics, everything, your age,
Okay.
and what has been done to you primarily.
And also I feel after this Invisalign treatment, my shape of the face is oval. It's getting little.
It's nice only. That's okay.
Okay.
It's not bad.
Okay.
That's good. See, but you have to understand that's an irreversible process. People, orthodontists, sometimes are not aware that dental treatment can change the shape of the person's middle third and lower third of the face. Or maybe they understand and they don't tell the patients. But I have a lot of patients who've undergone Invisalign, especially extraction orthodontics, does change a lot in the person's face. This is common sense. Because you just pull out a tooth and then what happens to the space? What happens to everything? They change the angulation of the tooth into something like that. So had you come before the Invisalign, I would have been able to give you a very nice competent lip, good smile, no gum surgery, nothing. But now this has been done, and many times it's the patient's fault as well. They go and tell the orthodontist, "I don't want surgery. Whatever possible, do for me without surgery." Because we have an orthodontist team here. They've been told like this
No,
often.
I have consulted surgeons as well as orthodontists, multiple, not even one or two.
And what did they say?
And everyone says like the jaw surgery is not needed. Only one doctor, he told me your
Was
teeth
needed-
alignment is too good.
Was needed before you started Invisalign.
Yeah.
Did you consult them
Yeah,
before?
yeah. Before Invisalign, because I have been
Okay. And still they
thinking
said
about
no.
this for so many years, and then recently I have done. this.
So then it's maybe
Yeah.
the error
Yeah.
on that part.
Yeah. So after multiple suggestions, I just decided to go for Invisalign. So.
Otherwise, the other option is we can do a impaction, take the upper jaw upside, but some patients get very good result with that. You may not get very good result with it.
Okay.
So you can try this gum thing. I would recommend as a first mode of treatment.
Okay.
If you're still unsatisfied with that, with your gummy smile or with your incompetent lips, then you can consider something else.
Okay.
That's how I would look at it.
Probably, yeah.
After you've gone so much, that's why. I do a lot of jaw surgeries. I've just come down doing one. So it's not that I don't want to do. I just want to tell you
I get it.
the
Yeah, I'm
it's
very
going to be.
conscious about me not able to close the mouth at times, and that
When I look at you, that's not really the thing that
yeah.
hits me.
Okay.
The fact that you have gummy smile and the fact that the gums are visible in not a natural way, that's what actually is the bothering thing,
Okay.
if at all.
Okay.
So if you address that part of your smile, I think the incompetent lip is something only you will know,
Okay.
no one else,
Alright.
really.
Alright.
Because the facial balance is good, facial proportion is good, the smile is good, everything else is fine. So
Alright.
it doesn't matter.
Alright.
Done?
Yeah.
So you can go with her, maybe now a little later. You're going to finish that case now? Later, just explain to her and then, alright? So you talk to her, she let you know what is the procedure for this smile designing, everything.
Okay.
And then you can start off whenever you want. It's a day, it's like
Even
a...
right now I'm on Invisalign treatment. Can I still go ahead and do this?
You may want to stop that. Enough of that Invisalign.
Okay. Fine, but there is still a gap. Like
How you said
I'm
they're
on
bringing
my,
it out.
I'm on my
You said they're
third.
bringing it out.
Yeah. Because
Then you're saying the gap is there. Both are contradictory statements. If they bring it out, the gap will increase, unfortunately.
So what the orthodontist told me is like the teeth will go up, the bone or teeth will go up.
Okay, then you wait till you're give them enough time as much ever as you want,
Okay.
then start. But I don't think it's going to change.
Okay.
They cannot intrude a tooth.
That's
Where
what
will
I
it
was
go?
wondering.
Will it
I
go
was
inside the
wondering-
nose?
I was wondering.
It's already long. You can see. I'll show you the scan. This is your piriform rim. Where is it going to go into the nose? It's not possible. They only make it more straight, probably. Impossible to do anything more. I don't think there's any role, but if you want, then you can do that. Yeah, we'll have to work on the teeth. She probably will put some crowns or veneers or something on your teeth. That she will make a call.
Okay.
And then still, if you do desire that we have to take the upper jaw up by 3 millimeters, that's also a possibility.
Okay.
Technically, I can do it very easily.
Okay.
So we cut the
Do
jaw
I have
3
the
mm.
vertical maxillary?
No,
nothing of
no.
that
Otherwise, I
sort?
would have told you we can do
Yeah,
that first, right?
yeah.
It's more of a dental, this area, which is because of the treatment that has been done for you.
Okay. Yeah. Earlier, the teeth was like this actually. On the
Yeah.
first scan, it was looking like that.
Correct. So now it's straight.
Sure. Then.
Yeah.
Yeah.
Talk to her.
Okay.
And if you're okay with that treatment, go ahead with that. If not, I would still recommend you get that done first up, and then after that, if you're still wanting improvement, we can consider.
Okay. Sure then. All right.
All right.
Yeah.
Bye bye.
Yeah. Thank you, doctor.
You're welcome.